This is Dr. Ben Weitz with the Rational Wellness Podcast, bringing you the cutting edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drweitz.com. Let's get started on your road to better health. Hello, Rational Wellness Podcasters. Thank you so much for joining me again today. For those of you who enjoy listening to the Rational Wellness Podcast, please go to the Apple Podcast app on your phone and give us a ratings and review. That way more people will find out about the Rational Wellness Podcast. Also, there's a video version on my YouTube page, my Weitz Chiro YouTube page. And if you go to my website, you can find a full transcript and detailed show notes as well. So today, I'm very excited to be able to interview Dr. Isaac Eliaz, who has some very interesting information to bring us about a protein in the body that is an inflammatory marker that you may not have heard of, that's involved in quite a number of chronic diseases, including arthritis, heart disease, diabetes, chronic kidney disease, liver fibrosis, and cancer. This inflammatory marker is Galectin-3, and increased levels of Galectin-3 are associated with fibrotic changes associated with many of these chronic conditions, including heart failure, aortic aneurysm, and it's also associated with increased risk of quite a number of forms of cancer, including bladder cancer, breast, colon, and prostate cancer, among other forms. And Dr. Eliaz has developed a very special nutritional compound, a particular form of modified citrus pectin known as pectisol C, that can block and inhibit this inflammatory protein, thus halting the progression and even reversing these chronic diseases. Dr. Isaac Eliaz is a medical doctor and acupuncturist, and he's been a pioneer in the field of integrative medicine since the early 1980s. He's a very respected researcher, formulator, author, and clinician. He also has a busy private practice in Sebastopol, California, the Amitabha Medical Clinic, with a focus on cancer, Lyme disease, and other chronic conditions. Dr. Eliaz, thank you so much for joining me today.
Thank you, Ben, for talking to you again. I always enjoy our conversation and our meetings in person.
Yes. I do as well. So can you tell us about this inflammatory protein in the body that plays a role in the development of so many of the chronic diseases that are the major killers today?
Yeah, of course, I'll be delighted. I've been involved with Galectin-3 research and clinical substantiation for 25 years. Galectin-3 is what we call a carbohydrate binding protein. It's a lectin. It's a protein that binds carbohydrates. And although often unknown, there are well over 8,000 published papers. There are more than 50 published papers on pectisol modified citrus pectin, the specific modified pectin that I developed. So what's so important about Galectin-3? It's really an unending evolving story, especially now that I'm working on a book on Galectin-3 that will be out in a few months. I realized that Galectin-3 is much more than an inflammatory instigator than a marker. Galectin-3 is actually a survival protein, which means it gives the body a signal that it's under survival stress. So really, when we look at health and disease, and it's a very important concept, we people like you and me who are involved more in a holistic view of health recognize inflammation as a driving force of almost every chronic disease. It's interesting, in medical school, they still don't teach inflammation as a culprit. They can check it in certain diseases. It doesn't fall into the algorithm, unfortunately. But unfortunately, the news that I have to break is that really inflammation is not the cause of any disease. Inflammation is a response. It's a response to a survival signal. Now, even in my book and when I talk in medical conferences, I don't address the question, what causes survival drive, which is so important. That's why we are here. I teach it more in my meditation and healing retreat, open heart medicine. The survival mode is part of our so deeply ingrained fixation on things as unchangeable, as permanent. When things change for us, we feel like we are losing our ground, we are losing our stability, we're losing our survival, because if things change, one day we are not going to survive. So this dialogue, when the survival urge comes on, that's where our problems start in every single disease. It's a fundamental drive that moves us from health to disease. So addressing Galectin-3 is a movement from survival to harmony, from survival to health. Now, this kind of survival reaction has many systems in the body that it works in. One thing that we know so well is the sympathetic response. The sympathetic response, the fear, flight, fright, is a survival response, and it saves all of us. It saved my grandmother in the Holocaust. That's why I'm here, you know. But it has a cost, because it puts us into a survival stress mode, and all our stress signals, all our repair systems turn on, and our way to repair, our way to respond is through inflammation. If we can make the inflammation be there for a few seconds and stop, that's great. But unfortunately, once Galectin-3 is turned on, the inflammation keeps going. And the end result is fibrosis, degeneration, cancer, more aggressive cancer, more aggressive congestive heart failure, more aggressive liver disease, more aggressive kidney disease, and all of these are substantiated in many of these. I am the one who is developing the clinical trials. So addressing Galectin-3 is what we call an upstream molecule. It is called medically an alarmin. It sounds the alarm. The problem, we cannot turn off the alarm. So our job is to turn off the alarm. Spiritually, psychologically, emotionally, physically. All of these highways turn on the same protein. The same protein on the cell membrane and outside the cell creates biochemical changes, stops normal sugar metabolism, puts it into a stress response intracellularly that can lead to diabetes, to autoimmune disease, and to cancer. What's so beautiful about it and amazing is that Galectin-3, which is a structure that has this kind of, it's an amino acid part, and I should have a drawing next time I will, and the part that bind the carbohydrate.
Right.
Like different carbohydrates can bind, Ben. It's amazing. And we call this the sugar code. So based on which carbohydrate bind, you will get a different response. You will get angiogenesis. You will get inflammation. You will get escape from immune response that the cancer uses. You will get overstimulation of the immune response with the cytokines that cause damage like IL-6, IL-4, IL-8. So the Galectin-3 is a backbone that allows all the different reactions to happen. So a small change in the levels of Galectin-3 will lead to dramatic change on levels of other inflammatory compounds downstream, below it, and will lead to severe damage. And that's why addressing it is really one of the most important, if not the most important, dietary supplement regimen we have to take, because it's getting stimulated all the time in an inappropriate way.
It's interesting you're talking about cell survival, this primitive mechanism, because there's a lot of talk these days, especially in functional medicine world, about anti-aging and using things like fasting and intermittent fasting and super low calories. And that's to sort of stimulate the same survival mechanism, to stimulate, some of these anti-aging mechanisms like clearing out old dead cells, etc. So It's kind of interesting that
Well,
that's
it's a great point. It works in the same mechanism. So what happens when we eat sugars, too many sugars, we get less sensitivity to insulin receptors on the cells, right?
right.
Insulin resistance.
Yes.
Galectin-3 in an inflammatory environment, or if there is too much galectin-3 that causes inflammation, will block insulin receptors. And intracellularly, something called AMPK, adenosine monophosphate kinase, that causes normal sugar metabolism gets shut down. And then we move into the mTOR1 pathway. It's the glycolysis, which means even in the presence of oxygen, where we can just relax, the cell goes into crisis and feels like it needs to produce energy very quickly, causing acidosis and causing eventually cell death. If you think about cancer, what is cancer? Cancer is a cell in the body that decided not to be a part of a community of 50 trillion cells. It got into a survival mode, right? And created its own community. When it isolated its community, how does it isolate its community? With galectin-3. It creates a lattice formation, the coatings, the biofilms that the bacteria use, or the virus, or the Lyme spirochete used to hide from the immune system. It all uses galectin-3. And then what it does, it creates a different biochemical microenvironment, an acidotic, an anaerobic microenvironment, an environment that is good for cancer to grow, for infections to grow, for diabetes to develop, all the same. So when you fast, you shut down this mechanism. The cell gets a rest. It's not fighting anymore. The mTOR1 gets blocked, this pathway of emergency, because we are getting energy through fats. And we reestablish the AMPK. We reestablish the ability of the cell mitochondrial function to really do it. The signal that starts it very, very early on is galectin-3. So of course, just like we are fasting or doing intermittent fasting, in the same way, when we take galectin-3, we create this very important response on an ongoing basis. That's why you see really addressing galectin-3 is at the top of anti-aging. I've mentioned it already in A4M in 2011, and hopefully in another 5 years, they will invite me again so I can actually tell them, okay, guys, let me show you why it's so important. It takes 15, 20 years for an idea to, I've used it, it's my life story. So
yeah, no, absolutely. It's very common. It takes a long time for a new idea to be incorporated into common medical practice. So, galectin-3, this is a thought I had, is a lectin, right? Now, there's a prominent functional medicine doctor who has been telling everybody to avoid eating any foods that contain lectins, even things like tomatoes. So lectins are inflammatory and harmful to our health. Is that intersect with the fact that galectin-3 is a lectin? Would eating a low lectin diet be helpful to lower galectin-3 levels, or is that a separate thing?
So lectins do fold. They are carbohydrate binding protein, and they support everything that I said. That it's important for people who are inflammatory. Having a low lectin diet makes sense if it fits with everything else in what you need. It's very individualized. But it's a difference between needing to catch one, let's say, specific fish in the ocean that really causes a problem, and they're throwing the net everywhere and hoping the right fish falls in. Okay. The real issue is galectin-3.
Right.
So what we see when we started this research, in 1995, when the first paper in Journal of National Cancer Institute, the #1 preclinical oncology journal from the National Cancer Institute, showed that when you give modified Pectin to mice that were injected aggressive prostate cancer cells, it prevents metastasis. This was the first time ever a drug, any compound was shown to do it. And I love to tell the story. If this was a drug, believe me, it would have been a multi-billion-dollar drug. It was just a unique modification from the citrus fruits. So since then, I made a lot of discoveries. I discovered the role of modified Pectin in blocking galectin-3 and preventing inflammation and fibrosis and chelating heavy metals and enhancing the immune system. And suddenly we realized, wow, galectin-3 is so much bigger than what we thought because of its regulatory effect. And nature has given us such a simple solution with modified citrus pectin. In the clinic, I use more extreme measures. I use something at Amitabha Clinic in Santa Rosa. I use therapeutic apheresis, which is similar to dialysis. It's formerly used for LDL apheresis for heart disease. And interesting, now we're getting some interest in chronic kidney disease, which I've already been researching for many years. But when we pull these inflammatory compounds out, including about 30% of Galectin-3, we see an improvement in all inflammatory conditions, better response to cancer, and improvements across the line in all degenerative diseases. Often you would say miracles in the medical standards, and they happen very often. If the person has inflammatory compounds, you remove them artificially. So that's an extreme way of doing it. But if we supply the body with a natural, safe, uniquely modified fiber like Pectosol C modified citrus pectin, you will get all the benefits that are associated with blocking Galectin-3. Now, often people will ask, don't we need Galectin-3?
Right. I mean, isn't inflammation a beneficial factor for helping repair, tissues from injury, and also in helping us fight infections?
Right. So that's a great question. So Galectin-3 has two different roles. It has a role intracellularly inside the cell, whereas part of its survival role, what do you want to do inside the cell? You want to make sure the cell develops normally. So it helps embryogenesis of the cell. This Galectin-3 inside the cell, inside the nucleus, we don't get to it. We are interested in the Galectin-3 that is outside the cell, that is on the membrane, that is creating the interaction between the cells in the body. Because if we take a deep breath and we look back, each of us is a miracle. We have 50 trillion cells functioning differently. All of them started from the same few 8 cells of the blastula. So while they have differentiated and taken different roles, they started from the same place. Amazing. And they communicate with each other. We know now that there is a communication network in the body that tells the cells what to do. This is a harmony. And as long as it's like this, the cells communicate through the extracellular space. When Galectin-3 isolates a cell, for some reason, we get the abnormal response. So if you need an inflammatory response locally, the body will still excrete Galectin-3 and create the repair. The problem is that once you had an inflammatory response, it stays off. A great example is sepsis. Sepsis, infection in the blood. So sepsis is life-threatening. 600,000 people die a year from it. And you don't die from the infection, you die from the inflammatory response. So while in the past we thought that Galectin-3 is a chronic instigator, we are doing some research in animals. We are showing within 20 minutes, Galectin-3 spikes in the blood and starts mobilizing the immune system to the infectious site. Now, it did its job. After some time, it starts being used by the infectious agent to escape from the immune system, to cause immune energy. And the body now is, because of the Galectin-3 is an alarmin, it creates an extreme inflammatory response that will kill us. If we can shut down the inflammatory response, it's some of the research I'm doing now with therapeutic apheresis, because it has to be done in a hospital ICU setting, I think it can save hundreds of thousands of lives. So the beauty of Galectin-3 that where it's needed, it's still going to be excreted by the macrophage, by the cells, but the modified citrus pectin will prevent its long-term damage. Because remember, it just has to give the signal, and then it has to let the body communicate. That's what's so amazing about this. It really causes us to move from harmony to survival with a war. Nobody wins in a war. I mean, nobody wins in a war. There are always, always damage, always collateral damage, right? It's unfortunately
Yeah.
image. But if there's harmony, everybody wins. Everybody wins.
Right. So explain how Galectin-3 creates some of these chronic inflammatory conditions and fibrosis, and how does it play a role in cancer as well?
Yeah, I'll be happy to explain. I can send you some slides if you want to put them on. So if you look at one of my favorite slides where Galectin-3 is in the middle, so Galectin-3 initiates multiple pathways. It initiates an inflammatory pathway, but by stimulating macrophage to become inflammatory, and then they excrete IL-6, IL-8, TNF-alpha, and cause ongoing inflammatory damage, for example, rheumatoid arthritis. Okay, it also stimulates the fibrotic pathway, also through TGF-beta, and causes fibroblast, myofibroblast stimulation and damage to normal functioning tissues. The muscle becomes hard. For example, in congestive heart failure, if your Galectin-3 is under 17.8, 12.5% of the patients will die in 1 year. If your Galectin-3 is over 25.6, not such a big difference, but you're having a fibrotic process, the heart is becoming stiff, 37% of the patients will die in 1 year. 12.5 compared to 37% in 1 year. Why? Because it causes fibrosis. In the cancer environment, it will cause chemotaxis. It will call angiogenesis cells to come and create new blood vessel. It will stimulate the cancer to be more aggressive. Why? With the same discussion, metabolic discussion we discussed that we want to prevent with fasting. It causes an abnormal intracellular metabolism in the cancer cell, the Warburg effect. The cancer cell becomes more aggressive. For example, the PET scan, the sugar uptake goes higher. And as a result, you get more aggressive cancer, both on the primary tumor and in the metastatic process. For example, in a multi-center trial that we are doing on our modified citrus pectin in biochemical recurrence of prostate cancer, the prostate cancer was removed. There is no PSA. PSA starts coming back. You know it's cancer. And often in a PET scan, you can see uptake of radioactive glucose in the prostate bed. And we can see over time that over 70% of the patients will benefit either by slowing down the process, by stopping it, and for many of them, by improving the process. So this multi-center trial, we have presented some of the data already at ASCO, and we are continuing the presentation on 59 patients, and we'll publish the different aspects, including a long-term 18 months follow-up soon. But we are showing not only clear benefit, but we are showing that the metabolic effect is getting better. Now, that's amazing over many years, because we are reorganizing the system from a survival fight to a harmony health.
So explain what that means exactly.
It means that once we're in a state of harmony, there's less inflammation, there's less fibrosis, there's less cell tissue, there's better blood supply, there's better oxygen coming into the tissue, there's less oxidative stress, right? There's more antioxidant working. And glucose is more balanced. Insulin doesn't spike. Metabolically, the immune system is working well. Galectin-3 completely shuts down the immune response, completely. That's why it plays an important role with immunotherapy in cancer. So we are moving into a place where the body is more in a parasympathetic harmony state, and we know that this is a state that promotes longevity. The survival of the species. We think that Darwin said that the toughest are going to survive, but really what he said society that are more compassionate, that are more supportive of each other, are the ones that are going to survive. Why? We still have a survival urge inside, but now instead of one cell surviving, our whole body as a system survives together. And suddenly we realize, wow, if my neighbors, if my friends, if my enemies are healthier, and we respect each other, and we open our heart to other, all of us are going to do well. We know. And then what happens? Everybody gets healthier. We know now in double-blind clinical trial that compassion-based distant healing, when people don't know about it, creates a beneficial, healthy effect on the recipients without them knowing that it's being done on them. When we take their difficulties, when we take in their negative emotion that will cause a stress response, and we transform and send them love and compassion, of course it's affecting us. There are many studies, because instead of a negative emotion creating a sympathetic survival Galectin-3 mode, it creates a relaxation, and then our telomeres get longer, everything gets better. This is well established. So by reacting with compassion instead of fighting, not only we affect us, we affect others. So naturally, if each one will do it to each other, we'll have longevity. This process is built within our body. It's what our heart does, and it's what every cell does when they are in communication. What causes us not to react? We feel unsafe. We feel threatened, right? So when the cell gets a threatening signal, what is threatening? It's an injury. Emotional, psychological, spiritual, physical, we respond. We respond, nervous system, sympathetic response. We know it's a devastating response. Blood pressure goes up, vascular damage, endocrine damage. I mean, this is all news. But we also respond metabolically. When the sympathetic response goes out of control, we can take 10 deep breaths, it gets better. When the metabolic system goes out of response and we get a chain of event, it's often irreversible. And I think about it, you know from your work with people, somebody gets an ankle injury, okay? And they just don't treat it properly. And then the hip goes out, and the lower back goes out, sure, and the neck goes out, and the upper back goes up, and now the sympathetic response, the blood pressure goes up, and suddenly they're going to die in 10 years instead of 50 years. The whole thing was the ankle. We see this every day, right?
Absolutely.
If you could just heal the ankle, get out of the survival mode, and the body would relax. So these reactions are happening on a cellular level, on the membrane level all the time. That's my message, because my passion is really meditation and healing. And while my healing, open heart medicine, is how to use the heart to create harmony, it's fascinating for me that my research career has discovered the protein that does it. You see, I'm coming to it from a research, with NIH grants, with double-blind clinical trials with Harvard, and I'm coming from it as a well-trained Buddhist meditator, who teaches meditation and healing and practice. It's all connected. So our membrane decides, are we going to be in good communication with our neighbor? Then what happens? The extracellular space is less oxidized. There is better nourishment. The tendon of the ankle is going to heal faster. Fascinating.
That's great.
Galectin-3 is like the message, and that's why I tell people, you got to use modified citrus pectin. It's crazy not to use it. And I tell this a lot, Ben. If you look at my charts 10 years ago, even if it's my product, I used modified citrus pectin, but not on every patient. It wasn't the first supplement I wrote. There were other things we were interested in. Now that I recognize what Galectin-3 does and how we got to address it, there is not a person that shouldn't take modified citrus pectin. I mean, the pectosol is a universal supplement, not because it's mine, because part of my ethics and philosophy, I look at what I do, I recommend to make sure there is no personal interest. I'm not doing it out of a personal interest. That's the basic motivation of an open heart, But I realize, wow, nature is giving us something which is not perfect, but allows us to bring harmony. And that's why while we were researching cancer with modified citrus pectin, suddenly we realized, wow, blood pressure is going down. Memory is getting better. Joint pain is going away. Autoimmune diseases are getting better. How is it possible? Now we know, 25 years later, the world is smarter. I got a little bit lucky. I figured it out a little bit earlier, so I have the discoveries for it. But my role is to share it with others. It's really a gift from nature.
Can you explain how your version of modified citrus pectin is different? Because there's other products on the market that are named modified citrus pectin, but yours is designed in a very specific way, correct?
Yeah, yes. So modified citrus pectin is a generic name. Every pectin has to be modified when it's taken out of the peel. So Pectasol C is a very specific modified citrus pectin. That of course,
and it's coming out of the peel of a citrus fruit.
exactly. And of course, we have all the patents and discoveries because we made the discoveries. And as it is in a capitalistic, competitive society, it's called borrowed science. People are cannibalizing my 25 years of work. It's okay. I just have to do better and put out the message. It's built in a very specific structure of molecular weight, size, while preserving its unique structure. So it gets absorbed into the bloodstream. For example, we are the only modified citrus pectin, in fact, the only pectin where there is a proof using special antibodies that our modified citrus pectin gets absorbed into the bloodstream. We are the only ones who have a proof with antibodies, okay? So we have, and you can assume others may get absorbed, but we know that we do it, we know the half-life. But this modified citrus pectin, Pectasol C, is now much bigger than my work. It's being researched by multiple academic and medical institutes all over the world, with average one paper a month being published on it. So we are well over 50 papers by now in the field of cancer, in the field of congestive heart failure, in the field of kidney disease, in the field of liver disease, in the field of lung disease, in the field of immunity, and very important, in neuroinflammation. Neuroinflammation is driven by Galectin-3. Very important for people to understand. The Alzheimer plaque has 10 to 20 times more Galectin-3 than normal brain tissue. So, and we are seeing the effect, with memory, with just better mental function when you take high-dose modified citrus pectin. So yeah, specifically, it's really Pectasol C, where all these 50 papers are on this one specific modified citrus pectin.
So let's start with cancer, prostate cancer in specific. Where are we right now in terms of the research, in terms of the potential for modified citrus pectin, Pectasol C, to prevent prostate cancer and to be of benefit with patients who have prostate cancer, including metastatic disease?
So the mechanism of Galectin-3 affects prostate cancer through different stages. And it's also important to emphasize now that because of its role in modifying Galectin-3 and exposing the cancer cell to the immune system, naturally blocking Galectin-3 with modified citrus pectin is a remarkable adjuvant. It can be used with surgery, with chemo, with radiation, with hormonal therapy. We have shown all of this, okay, in different in vitro animal studies. Our main study is in biochemical relapse, because biochemical relapse is a great model. There is no more prostate. There is no PSA. It was taken out either through surgery or through radiation, and now PSA starts coming back. It's not from the prostate. There's no prostate. It's from the cancer. So the rate of increase of PSA becomes very indicative of the progression of cancer. So we have already published 2 previous studies, a pilot on 7 patients and another study on 10 and 12 patients in a good journal showing 80% response. So now we are doing a multi-center trial in Israel with 4 or 5 hospitals participating. And there's the remarkable oncologist, Dr. Daniel Kaitzman, who is a urological oncologist in Israel, said, he just WhatsApped me, he said, Isaac, he says, when I started this, I was a skeptic. Now I'm such a believer. I'm so excited about what you guys are doing. And he's really helping us to study it in different cancers. Because what we are seeing in this group, where once the PSA starts going up, most of them, 80% of them, will continue to go up and eventually will develop metastatic disease. And instead of having in 6 months, 80% of them develop, we have only 25% of them develop.
Now, once the PSA starts good, the PSA is indicative of prostate cancer cells being somewhere in the body. Is that correct?
Yes. Once there is no prostate, absolutely, yes.
So if there's any PSA rise, it means it's already
Coming back. Exactly.
coming back. Okay.
And you want to time when to start the hormonal therapy, because once any therapy you start, it's like a scent clock, It's going to work for a certain period of time. So what modified citrospectin we are saying in the study, it's delaying the need for us to start conventional treatment with the side effects. But it's really interesting to see what can we learn from it. Why is it so significant? Because think about it, Ben. Here we have, there was cancer in the body. It was treated locally, and it's starting to come back. Now, the body theoretically can kill the cancer cells, but it's not able to, right? We know it. We are allowing, through the use of modified citrospectin, we are allowing the body itself to either slow the process, the PSA doubling time slows down, which means it goes up slower. We are allowing the PSA to completely flatten, stop, or we're allowing the PSA to even get better, because we are affecting the primary tumor, which we're also seeing in PET scans, which we will publish later. And interesting, we are seeing this effect on an ongoing basis. We are seeing it after 18 months. We'll be presenting in November in a big oncological, urological conference, and we'll show a significant slowing down and lack of progression even after 18 months. So if I delayed a treatment that has an X amount of time of effectiveness by 18 months, I have added 18 months of net life, of high quality life. Not only is there no side effect, but when we look at people's reports, they say, by the way, my energy is better, my arthritis is better, my memory is better, I feel better. These are the side effects of modified citrospectin compared to impotence and bone density loss and metabolic syndrome and damage to the heart that you get with hormonal suppression, So it's kind of a good deal.
Is there any reason to cycle the modified citrus pectin instead of taking it continuously for a period of time?
Wow, that's a great question, not often asked and very wise. We cycle often hormonal therapy, so the cell doesn't get resistant to it, but you don't do it in the case of modified citrospectin because the Galectin-3 is never useful. It's like a trigger. It's so upstream, but it's always good to take a break on supplement, like a weekend or a day a month. I often tell people just before the new moon, take a day or two off, let the body recalibrate, or between seasons, like equinox and solstice, definitely. But with modified citrospectin, people ask me who need to take it. I say anybody that is breathing. Very effective. We have studies on modified citrospectin, significantly reducing lead level in children with toxic lead levels in China, and increasing the urinary excretion, showing it does get absorbed. So we are bombarded with heavy metals. We are bombarded with toxins, and Galectin-3 plays a role in allowing these toxins to hide by creating these shelters. So very important for detoxification. Modified citrospectin is essential.
Now, can modified citrus pectin actually bind to heavy metals, or is its role in reducing the inflammation and breaking up the biofilms to make it easier for the body to get rid of the heavy metals?
So pectins in general, and specifically our specific modified citrospectin with its specific structure, is one of the most powerful binders of heavy metals, especially lead. But also, we just published a paper on the ability of our modified citrospectin together with alginate to bind to uranium. It was just published about 2 weeks ago in the peer review paper. Why?
Is there some controversy over its ability to bind heavy metals?
No, none, zero. Because it's a group called polyuronides, just like alginates in seaweed. And polyuronides are known to bind heavy metals. It's well established in the literature. We have now shown it in, I think, 3 or 4 different clinical trials or case reports in decreasing mercury total body burden, increasing urinary excretion. These are studies we've done with the USDA. And, and the USDA helped us to learn the structure. Modified Pectin has a side has a side structure called rhamnogalacturanan 2. Rhamnogalacturanan 2 can get absorbed into the bloodstream, is an important immune enhancer, and can chelate heavy metals. Rhamnogalacturanan 2 is the active compound in mistletoe. So 10% of our modified citrus pectin, our specific one, Pectin C, is rhamnogalacturanan 2. We published it. That's probably one of the mechanisms for the immune enhancement. We did some studies on immune enhancement, and we tested different medicinal mushrooms. This was in 2006, around the time, I think. And we also decided to test modified citrus pectin. And sure enough, we published only on our modified citrus pectin. It was so much more effective. And we know the mechanism. It doesn't stimulate something. It allows the body's immune system to function better. Again, this harmony.
Interesting. For those who aren't aware, mistletoe extract is sometimes used by some functional medicine oncologists in combating metastatic cancer.
Yeah, Viscum album, it's very big in Europe for centuries.
Okay, so let's talk about the use of Pectin C in combating heart failure. Now, I saw one paper where it was used compared to the leading medication for heart failure. And I spoke to one cardiologist, the integrative cardiologist, who said, look, we know that this other medication is beneficial. It would be risky to use modified citrus pectin. Is that true? Could it be used in combination with the other medications that are used?
Right. So the modified citrus pectin, the only issue sometimes is that modified citrus pectin is buffered with potassium and sodium at a ratio of 4:1, which is what we have in fruits. Fruits have potassium and sodium. So if you have extreme kidney failure, if you're like pre-dialysis, a stage 4B or stage 5, you already you have fluid retention, you may want to take only 5 grams a day because you have to be careful on your potassium.
So the dosages of the Pectin C ranges from like 5 to say 20 grams a day. Is that right?
Usually 5 to 15, and if the Galectin-3 is very high, above 20, 25, you can go up to 20.
Okay.
So we just finished a double-blind clinical trial with Harvard in hypertensive patients to see if we can prevent congestive heart failure.
Yeah.
6 months, it's a small group, 30 and 30. So even if it's beneficial in small groups, sometimes they will say statistically it's not because it's a small group. Nobody, but the group in Harvard, it's an independent study. We're not involved. We just supplied our product, Pectin C, and they're looking at some fibrotic proteins. They're waiting for the results. But one thing we know, there were no side effects. It was well tolerated, both the placebo and the active. So actually,
were these in patients after a myocardial infarction, or
no, these are more patients with hypertension with signs of congestive heart.
Okay.
So we know that it can definitely be used in combination with other medication or other regimens. You just want to take it a little bit away, half an hour away from, especially away from statin drugs, which I'm not a great supporter of unless the lipoprotein A is very low. But what happens, there is yet no anti-fibrotic medication for heart disease. I mean, aldactone, which is an aldosterone blocker, indirectly affects Galectin-3. So in studies in animals, they show that aldactone, spironolactone, and our modified citrus pectin had similar effects on the congestive heart failure, but only modified citrus pectin was beneficial for the hypertension and was able to reverse the aortic stenosis, to reverse the narrowing of the main artery of the body. So there are about 19 or 20 papers now on our modified citrus pectin in heart disease, in kidney disease, in circulatory diseases. There is all of them showing positive results. There is one paper where the researchers in Australia used a different modified citrus pectin and sure enough, it's the only paper where there were no results. And this is what it takes: one drop of lemon to ruin a whole bucket of milk. All your research, and I'm sure the cardiologist will jump on this one paper. Nobody will pay attention that it's not the right modified citrus pectin. And I have to say, I wrote a letter to the editor, and the journal did publish my letter, you know. And now I'm writing some bigger peer review papers to explain that not all modified citrus pectin are alike.
Yeah, it sounds similar to the story about niacin, where somebody, there was a number of studies showing benefits, and then somebody did a study using a product that contained niacin and also another drug that blocked the effects of the niacin, you know, where you block the flushing effect of the niacin. And then that study showed that there was a negative benefit, and they weren't using niacin, they were using this combination drug that had this other effect.
Of course, so it's common, but it's an example to show why people should really use the Pectosol C. And you know, and again, we are very committed. We're now doing so much research on it. But so in congestive heart failure, what happens is that there are two kinds of congestive heart failure. There's what you call systolic congestive heart failure, where the heart becomes like a rubber band that doesn't contract well anymore. So it gets expanded too big. The muscles contract in such a method, so they have to overlap in order to contract. When the heart gets too big, the overlap gets smaller, and the heart loses its muscle power. So you give digoxin, you give beta blockers, and these people can live for a long time. So what happens, the percentage of blood that is pumped out goes down because the rubber band is not contracting. Now we can help the contraction. The most deadly congestive heart failure, which is diastolic, is called the ejection fraction preserved congestive heart failure. What happens? The heart still contracts, but instead of the heart contracting like this, it becomes stiffer, and then it still contracts the same percentage, but very little blood comes in. So it becomes like a rock, you know, just like a rock, and that's the deadliest heart failure, where in 3 years, 100% are dead pretty much. That's the heart failure when I mentioned that 37% will die in 1 year. Modified citrus pectin helps this kind of heart failure. But it's not so simple. A person can have two kinds of heart failure at the same time.
Oh, wow.
If we can prevent the fibrosis, we'll prevent the issue. Now, here is the bad news. The Galectin-3, which is making this worse, may be coming from the kidneys, may be coming from the liver, may be coming from arthritis, may be coming from stress, and it's making the heart worse. The modified citrus pectin doesn't say, hey, I'm going only to the heart like specific medication. It helps all over. So the concept of a heart like stone, you know, it's a beautiful stone. There was a very famous Israeli poet after the 67 war, where when the Wailing Wall was liberated for staying away from political point of view, she wrote a song, and she said, there are hearts that are like stone, you know, and there are stones that like a heart, because so many people get emotional no matter what is your religious belief. So this heart of stone, this fibrosis, it's a profound message, because our heart is built to take difficulties and pain, clear it by breathing into the universe, and just nourish the body back. We are built to be compassionate. If we become like stone, we're not willing to share, we get ejection preserved congestive heart failure. That's part of the survival. It's profound. It's not like a new agey thing. It's a basic, it's the basis of Buddhist approach of not accepting impermanence, And I think that's where medicine, hopefully, that's the next level of medicine. And looking at genetics and pathways, functional medicine, it's good, but it doesn't get to the root. And the beauty is we have the biochemistry, we have the pathways, we have the physiology, and nature, at least at some capacity, gave us a gift through modified citrus pectin.
Fascinating. Arthritis, the potential benefits of modified citrus pectin in preventing or treating arthritis.
So it is well established, especially in the more aggressive inflammatory arthritis, like rheumatoid arthritis, SLE. We're just about to start a study on scleroderma. It also has a benefit in osteoarthritis, and we showed a difference in a double-blind clinical trial with Harvard, but the groups were very small, only 25. So statistically, it wasn't significant. It was very interesting. We benefited 80%, but the placebo was 60%. Because sometimes the way you put your questionnaire, and what happened, there was a clear difference, but not enough to show statistical difference. So we're going to do a bigger study, but there is clear difference. We know the mechanism. And
osteoarthritis is the most common form of arthritis.
People will tell you, I know from my own experience, I did a certain medical procedure and I decided to go from 5 grams to 15 grams, full dose. And now I recommend 15 grams for everybody based on this. And what was amazing for me, my memory came back. It was the only thing I changed. My memory came back like it wasn't for at least 5-7 years. And my back pains were gone. My joint pains got better. And I'm traveling a lot. I realized, wow, even if my Galectin-3 is lower because of how I live, it went down from 17 when I was high in Tibet treating people and I was under oxygen deprivation. Even if it's 11 or 12, it's in a good range. I really never experienced myself the amazing benefits until I went to 15 grams.
Huh. And so is that what you recommend for patients with osteoarthritis?
Oh, definitely. But I also recommend it. Now I recommend my maintenance dose. 5 grams will do something. But if you have any inflammatory complaints, experience a full dose of 15 grams. 7.5 twice a day or 5 grams twice a day, 3 times a day. And it's very good to combine it with a probiotic.
Oh, really? Why?
Yeah, because it affects the microbiome.
And is that specifically for arthritis or for any condition?
For any condition. Because there's a whole role there are quite a few papers published in our modified citrus pectin showing its benefit in establishing a healthier biofilm, preventing aggressive bacteria from growing, and helping normal bacteria to actually grow in the gut.
Interesting. What about combining modified citrus pectin with like a glucosamine for joint problems?
I think it's an excellent idea. Definitely.
Cool. And then I saw you speak recently and you were highlighting the benefits of modified citrus pectin for neurodegenerative conditions like Alzheimer's disease. Can you talk about that for?
Yeah, of course, because one of the stimulants that causes it's an inflammatory stimulant. It's what really is excreted by bacteria. It's called different lipopolysaccharides that cause nerve damage. And that really is a byproduct of sepsis. They cause nerve damage. So when we test, when they do animal tests that artificially create LPS surges, either by injecting LPS or by creating an injury to the nervous system, you see an increase in LPS, you see an increase in interleukin-6, the inflammatory. And when you give our modified citrus pectin, you bring it almost totally to normal. It's crazy. Because remember, it's not the injury, it's the inflammatory response that causes the damage. We know now that even the nervous system can repair itself. each of our cells in the body, the individual cells, hasn't been with us. If I'm going to be 60 soon, my cells haven't been with me for 60 years. They are changing all the time. But they are getting the message from the previous generation, right? Our cells are multi-generational within our body. Our body is multi-generational within everybody that made us in the past. And the past affects the present and affects the future. And not to get it too complicated, the future affects the present, but I won't go into it now. So we and I teach it when in the meditation retreat, and you experience it. So our cells are programmed that they have to cause pain in the joint, right? When one cell dies, another cell comes up. Well, we can change the programming, and Galectin-3 will help into it. That's truly why mind-body medicine is unlimited. That's one of my most favorite sentences is, not everybody will be a miracle, but everybody can be a miracle. And this is a choice we have. So it's another beautiful sentence in Judaism, how to translate. It says, everything is known, expected, but we still have the choice. The expectation is a genetic movement, the habits, the cells giving messages to each other. The choice is we can take a different highway. And that's where Galectin-3 is so important, to understand it and address it.
Beautiful. That's a great way to wrap this conversation. So how can listeners and viewers find out more about your products and find out more about you?
They can visit dreliaz.org, dreliaz.org, where there's a lot of valuable information and health reports. They can also visit Amitabha, AMITABHA clinic.com. And when they go to my website, they can click on modified citrus pectin, and it will give them specific information, of course.
Awesome. Awesome. Thank you so much for a great interview, Dr. Eliaz.
I always love talking to you. And once my book on Galectin-3 is out, hopefully in 3 months, 4 months, we can do another one, and I can specifically highlight some of these points.
Awesome. I look forward to that.
Thank you so much. Thank you for the opportunity. Take care. Hope to see you soon again.
Sounds good.